Alright, thank you very much, Abby. Assalamualaikum dan good day, everybody. And I hope you guys enjoy the conference so far. My name is Uzaidi. I'm from the Tourism Productivity Nexus. As you know, the tourism industry is one of the worst industry impacted during this COVID-19. It will be the last to survive. It will be the last to revive back. So our next topic, our next speaker is very important for us, especially during for tourism industry players. I would like to introduce, without further ado, I'd like to introduce our next speaker. His topic will be behavioral insight to increase awareness on COVID. And we are so lucky, we are so happy to be able to connect with our next speaker, Mr. Alexander Clark. He's a senior advisor, behavior insights team, BIT of Singapore. We are looking forward on how we can use this behavior insight on how we can encourage more locals to be vaccinated without hesitance. We know there's a lot of fake news, we call it fake news on vaccinations. So we can't just implement the enforcement strategy methods. We need to use a lot of psychology. Therefore, behavior insight is very important for us. Therefore, I'm looking forward for our next speaker to talk and to present on the next subject. It is behavior insight to increase awareness on COVID-19. Okay. All right. The floor is yours, Alex. Thank you.
Thank you, Mr. Uzaidi, for that very kind introduction. So I am happy to begin to talk to everyone about applying behavioral insights against the COVID-19 pandemic. So first, a little about myself and the Behavioural Insights team. So my name is Alex. I'm a senior advisor at the Behavioural Insights team in Singapore. The Behavioural Insights team is a social purpose company. We're a private consultancy who do work for good, formed as part of the UK government with the mandate to find intelligent ways to encourage, support, and enable people to make better choices for themselves. We have been working on COVID-19 response globally, led in no small part by our dedicated COVID teams in various offices, in particular in our UK office. And we've been running lots of research studies over the past few months to learn more about COVID-19 response, how people respond and behave in the COVID-19 pandemic, to assist governments and other partners with managing their interventions, their policies, their actions. And so this is just one example on this slide of a finding that we've generated from our various different studies. Across the multiple trials and studies we have done, one thing that keeps coming up is that the younger the person is, the less likely they are to score highly in terms of recall of information. And it's especially problematic for younger men. And so it's these kinds of insights that we've been trying to generate and sharing with our partners as a way to help them improve their COVID-19 response and their policy actions. In terms of what the Behavioural Insights team does, we talk about putting policies to the tests. Tests is our methodology for applying behavioural insights to various policy problems. So we go through these 5 phases: target, defining a problem, and measurable target outcomes, exploring the relevant behaviours and the wider context in which they take place, designing solutions informed by the behavioural science literature, trialing, and I'll be talking a lot about trials today, with robust and rigorous methods, most often randomized control trials, experiments, and finally scale, which is all about, once you've run those studies, those evaluations, those trials, how do we take the learnings from that and put them into practice? So maybe good to remind everyone, when we say behavioral insight, what do we mean? I think this video is quite instructive for
the monkey business illusion. Count how many times the players wearing white pass the ball. The correct answer is 16 passes. Did you spot the gorilla? For people who haven't seen or heard about a video like this before, about half missed the gorilla. If you knew about the gorilla, you probably saw it, but did you notice the curtain changing color or the player on the black team leaving the game? Let's rewind and watch it again. Here comes the gorilla, and there goes a player, and the curtain is changing from red to gold. When you're looking for a gorilla, you often miss other unexpected events. And that's the monkey business illusion.
So I think that's quite a nice illustration of a behavioral insight, which is an insight into the way that we make decisions based on what we know about human cognition. And in this case, the focus is attention, the way that our attention works. Our attention can be directed very specifically to something, like counting the number of passes that the students are making. But when we focus our attention that way, it can become so focused that we miss other unexpected things, like someone in a gorilla suit wandering across the video. And so the idea of behavioral insights, or a behavioral insights approach, is really that if we understand how the human brain works, if we understand these little insights about the way that our decision making functions, we are in a better position to design policies and services that are effective and are impactful. So now I want to talk to you about testing using online laboratory experiments. And this is something that the Behavioral Insights team has been doing over the past year or so to help with COVID-19 response. And the way we do this is effectively using online surveys. So what we're doing is we're recruiting an online survey panel into our dedicated and proprietary platform, Predictive. And then that's that sort of big group on the left there. And then we're randomizing them into multiple groups. And some groups are receiving some sort of intervention, often a communication. So it could be a social media post, a poster, a sort of an image of a letter that we might send through the post. And some people are not receiving that, or receiving a different version of that. And then we are comparing outcomes for these two groups. And because the only difference between the people in the group that did see the communication and the people of the group who did not, or saw a different one, is this randomization, we can be confident that when one group is suddenly very concerned about COVID-19 and being safe and taking the right precautions, and the other group doesn't seem to be very concerned about that, we can be pretty confident that the reason for this change is due to our intervention, because the only other difference between these people is our splitting by random lot. So we're using these online surveys to run randomized controlled trials, to run experiments. And we've been collecting a variety of different outcome measures, and they range from the relatively simple, something like recall. So, I give you some information on a poster, and then I take the poster away and I see how much information you can remember, through to understanding, comprehension, something a little bit more complicated, to behavioral indicators like intention to exhibit a certain behavior, whether that's taking up a vaccine or washing your hands properly, regularly with soap, and then right up to the even more complex, like something like sentiment, whether, how it makes you feel, what's the emotional response, which can be slightly more complicated, both to elicit effectively, but also to interpret. But there is a sort of range of measures. And this is maybe a good moment for me to give you the sort of the summary about the tips from the evidence that we've been generating in the last year. So for those of you, I've talked about attention spans a little bit before. For those of you who don't manage to maintain attention for all of the rest of this presentation, at least you can take away these 5 little tips which we would definitely recommend for thinking not just about COVID-19 communications, but communications in general. So on the left here, it was an existing coronavirus COVID-19 communications campaign designed by the UK government. And so I'll walk you through the tips that we gave them based on extensive testing using online laboratory experiments, as I've just described. And then I'll show you what we came up with at the end of that testing. So the conclusions, the findings that we had suggested the following 5 actions. So firstly, putting the key action at the top, making sure that your communication starts by telling people what you want them to do, seemed to do very well in terms of things like recall and comprehension. Equally, using plain language, so making it as easy to understand as possible. In a similar vein, shortening text, using as few words as possible. And we did seem to find that the use of images and graphics, albeit you have to get the right ones, can be quite effective in terms of making sure your message goes across. Of course, the final tip is to keep testing. The 4, well, or indeed 5 tips are the results of extensive series of online experiments that helped us to learn, what small changes we could make, and eventually took us from the poster that you're seeing here to this poster, where, as you can see, the key action is towards the top. In nice big letters. We've reduced the text considerably, and as you can see, we've ended up, as a result of testing several different images and graphics, we've landed on this one in particular, which shows someone touching a door handle, which appears to have some sort of nasty virus upon it. So as I say, if nothing else, I hope that you take away sort of this key message here about how to improve the efficacy of many communications. But there are lots of other specific things that you can do, and I'll run through some examples of those shortly. However, if you want more detail, both on the examples I'm going to be giving today, but also on our other work to do with COVID, we have a dedicated section on the Behavioural Insights team website where you can find out lots more information. Okay. So now we're going to talk about a few case studies, some examples of our work. Let me start with one from some months ago now, which was all about reducing festive travel for Eid. This was a project we did in West Java in Indonesia. Obviously, Eid is a time, both Eids are a time of great travel, not just in Indonesia, but in lots of countries. And in particular, what you often see is young people who've moved to urban centers, often for work, traveling back to see their families. Now, during a coronavirus pandemic, this is an enormous transmission vector risk. There was a lot of concern that the young people would be in cities where coronavirus is spreading and would bring it to rural areas which previously hadn't actually had that much exposure to the virus, with devastating results. So a real tricky problem to solve, particularly because for many persons this will be the sort of the big time they go back home to see their family. So it really is a big event in the calendar. So in order to tackle this problem in West Java, we started by doing some qualitative research, some interviews with various people to try and understand some of the factors that might be influencing their behavior when it comes to traveling for Eid. And we established some key sort of drivers, things that were driving travel. So one was underweighted or unclear consequences. This was the idea that lots of people thought, oh, it's not, I don't know what's the worst that can happen if I travel. Maybe I'm underestimating how likely it is that I might be asymptomatic and bringing the virus with me. Maybe it's not quite clear, either whether, I'm going to get in trouble for traveling from the government, or indeed whether there's going to be virus transmission as a result of me traveling. So the consequences were not so clear. At the same time, there was a lot of social pressure. Of course, you're getting phone calls from your mother saying, when are you coming home? All the family wants to see you. It's been so many months since we've last seen you. So there's a lot of pressure to travel. And thirdly, a lack of clear alternatives. This was something that people did every year. People do every year, is travel to see their family. And it wasn't clear what what would I do if I wasn't traveling? This is the thing that I do for Eid every year. This is what celebration looks like for me. And so our qualitative research allows us to identify these factors that might be driving travel. And what we did is work on developing some new posters. So we started with an existing communication from the West Java Transportation Agency, which was asking people saying to people, don't Mudik, please don't travel for Eid. And it was showing lots of people, as you can see, doing just that. We tried something a little bit different. We thought that, based on the qualitative research that we had already done, we want to tackle some of these specific factors that have been borne up. So in the middle, we have this virtual Eid poster that we came up with. And this was all about presenting an alternative. As I said, one of the problems that we had observed in our qualitative research was that people weren't sure, if I'm not traveling, what am I doing? And so we said, oh, well, why not, use the wonders of modern technology to call instead. And we also gave some specific sort of items here. We added some stuff in to dispel misinformation and myths that we might be a bit worried about, particularly relating to the fact that older people were at risk, which we thought might feed into some of these unclear consequences I mentioned earlier. Our other poster, the silent spreader on the right there, speaks much more directly to this unclear consequences problem. It's this idea that we want to really express to people, well, actually, you don't think that anything bad is going to happen from you traveling, but that's because you don't realize that it's very possible that you could be the person bringing this to your village. You might not realize you have the virus. You might not realize you're transmitting it. And then, how would you feel if it turned out that you were the one who got everyone sick? So these are the posters we designed. And rather than doing, just asking people what they thought, or running a focus group, or just deciding ourselves which we thought was best, we worked with JDS to run an online laboratory experiment to try and test which of these might be most effective. And what we found was this. So in terms of recall of the main message, don't Mudik, the original poster was the most effective. That shouldn't be that surprising. If you remember the 5 big tips that I told you earlier, one of the big ones is put in big letters up front the main behavior, the action you want people to take. And the original poster did that. It says, don't Mudik in really big letters right at the top. So our posters did not quite as well on that because that wasn't as clear an action. However, on everything else, our posters did better. So it made people less likely to select false statements about coronavirus. And also we did some sentiment analysis around whether people thought it was easy to understand, whether people thought it was trustworthy, and this sort of sentiment/intention measure around whether it was likely to convince other people not to Mudik. The great thing about these kind of online experiments is that if you set it up right, you can be really quick. So on the Tuesday, we had the results, and we were saying to Jabbar Digital Service, okay, so this is what we found from the experiment. We seem to be that our posters are doing a bit better, and this is in what ways. And the very next day, they had redesigned and put up social media posts that reflected those findings. So you see, they've taken the silent spreader poster here, but they've also made some changes. They've made they sort of put a clearer message at the top because we saw that the new posters weren't performing as well on that dimension. And so that should really express, as I say, that these kind of experiments, they can be relatively quick to run. I mean, we're talking about a couple of weeks to set this up and run it, and that includes time to do that qualitative research, just a few interviews and do the design, and then running a survey, as I say, with a couple of thousand people to get this information, get this really incredible rich quantitative information about the impact, and then you can take advantage of those findings almost immediately, and that's what they were able to. My next case study is about how to teach people how to wash their hands properly. So we've been working in Bangladesh on COVID-19 with BRAC, the world's largest NGO. And one of the big things that BRAC are doing is this incredible initiative to build 1,000 public hand washing stations all over the country. And this is a picture of just one of those hand washing stations. You see there's several sinks, it's a water tank behind, and these stations have both water and soap, well, soapy water. So it gives lots of people access to soap, and access to soap is one of these big problems that many people have faced in terms of exhibiting good hygiene during the pandemic. Is just being able to access soap, cheap soap. Has been a real problem. So this initiative has been really great. But one of the things, of course, that we were worried about is that people wouldn't be washing their hands properly. I'm sure by now everyone's heard about, how long you have to wash your hands, 20 seconds and all this sort of stuff, various different techniques. One is singing happy birthday, the happy birthday song twice. I'm sure there are lots of others. And this was the problem we were trying to solve here. We wanted to think, okay, there's this big space behind the station. We could put up some sort of communication that would help to show people how to wash their hands properly. What should that look like? So we came up with a few different posters. We had an original poster that we had received from our partner. That's on the left there, with the sort of 4 steps, quite a lot of text. And then we came up with some different versions, and we also tried not showing people any poster and just saw, for people who don't see any information, how well do they know the hand washing steps. And so you've got the original poster on the left. We've got a very simple version which just says 20 seconds, sort of cuts out all the other information. And we just thought, rather than trying to teach people too much, limited attention, let's just give them one main message, 20 seconds. And that's it. Then we had a 4-step version and a 7-step. And the idea here was that, maybe 7 steps, maybe that's the most diligent way to wash your hands. Obviously, ideally, we'd get people to do that, but maybe 4 steps is a bit easier for people to remember, for people to digest. And so maybe that will be more impactful in practice. And that's why testing is so important, right? To figure out the answers to these kinds of questions. What we saw was that the 4-step BI poster performed best overall. So the overall comprehension score, it was sort of joint first with the other ones that we designed. But it also performed very well in terms of making sure people wash their hands for 20 seconds or more, and also making sure that people did remember the key steps and didn't identify unnecessary steps. So we did a sort of a tricky question here where we asked people, which of these steps are the right hand washing steps? And we included a couple of fake answers to see if people were paying attention and that they had remembered properly. And with the 4-step, people were really good at remembering these key steps. And so, this was one of the things where there was we had a discussion, one of the findings, made some adaptations. We ended up, as you can see here, with a sort of 5-step poster. And obviously, with all of these kind of testing, you sort of go through the testing, you get the findings, then you have to have another discussion, often with the subject matter experts here around hygiene specialists about, well, we found this interesting finding where reducing the number of steps seems to be better in terms of making sure that our message gets across, but there's always a trade-off because, of course, the more steps we have, the more diligently, in theory, people are going to be able to wash their hands. So this is what we ended up on, these nice bright colors as well, which is very good at attracting people's attention. Okay, little water break again. How am I doing for time? Okay, pretty good. Okay, right, next section. Now I want to talk to you about a relatively recent study that we've done in the UK on vaccinations. Of course, all over the world, vaccination is the hot topic right now, as more and more countries are organizing their vaccination efforts or pursuing vaccines and starting to get them implemented. And then we have this sort of next problem, which is all around how to make sure that our members of the public are coming and getting vaccinated. It's all very well us spending all this time, effort, and money getting the vaccine in, but if no one goes and gets vaccinated, it's not very useful. So what we did in the UK is we ran an online experiment. Again, recruited people through an online survey panel, and then randomized them into different conditions, so they were seeing different things. But we started by showing everyone the same thing. We showed this sort of BBC News briefing to give them the information that the coronavirus vaccine has arrived in the UK. And we asked them some opening questions just to get a sense of different people in our sample, their sort of general sentiment around vaccines, their general feelings around and thoughts around vaccines. So we asked, do you think the vaccine is going to be safe? Do you think it's going to be effective? And do you think it's important for people to receive the vaccine? Because we were interested in how People who respond differently to these questions might respond differently to different communications. So if you're someone who thinks the vaccine is super unsafe and super ineffective and it's not important that anyone gets it, you might respond, you might be pretty hard to influence, right? It might be very difficult to convince you with a communication. And so it's important for us to have this, a little bit of information about the people in our sample to help us understand how different people are responding to different information in different ways. So once we got that information about these people and how they felt about vaccines in general, we then randomized them so they would see different versions of an invitation to get a free coronavirus vaccine. And we had the same letter, same basic text, but we had this framing message at the bottom, and that was different every time. So we had the basic invitation, or we had the basic invitation plus the simple message, together we can end the pandemic. A social norm: the majority of people in the UK plan to get the coronavirus vaccine. Join them to keep yourself and your loved ones safe. The idea of this is that we're trying to express that a social norm is this idea of, this is kind of what other people are doing. What's the sort of, what does the community at large, our society at large, think is the right behavior, the right action? And what we're trying to express here is that most people think that it's good to get the vaccine. Most people are planning to get the vaccine. And so we're trying to express to the reader, most people think this is the right thing to do. So, maybe that should influence how you think whether or not this is the right thing to do. And certainly there's an extensive literature showing that social norms can be very effective in influencing behaviors. If people are feeling a bit uncertain, it makes us feel a bit more safe, a bit more secure if we hear that other people are going ahead and doing this particular behavior. Loss aversion: we know that people want to avoid losses. So we want to express the sort of loss, almost express the risk. Coronavirus has taken the lives of more than 60,000 people. Don't risk it. Protect yourself. Safety: previous research has shown that some people do express that where there is vaccine hesitancy, sometimes people talk about the safety of the vaccine, or it was tested too quickly, or that the tests haven't been enough extensive, or about long-term effects, these sorts of things. And sort of trying to address that specifically, we wondered if that would be effective. The coronavirus vaccine was developed with safety as the main priority. Tens of thousands of people have already tested it, so you can get it safely and try and sort of deal with that specific issue. A gain frame: getting the vaccine will protect you and your loved ones and help everyone get back to normal. So it's like, this is what you have to gain. This is the benefit. We wanted expressing that might encourage people to want to get the vaccine a bit more. And then finally, protect the NHS. The NHS, our health service, our healthcare system in the UK, loved by all, famously, is always the thing. Certainly the majority of people in the UK are always very supportive of the NHS. And so in various previous projects, we've often found that telling people that something that they can do will help the NHS, people like the NHS, they want to help the NHS. And so we wondered if this would be a motivating message to put to people. So what we found from these various different messages is that in general, around 7 in 10 people said they did intend to get the vaccine. And that was sort of the main measure. That's that top row there. And we found that adding these framing messages or an infographic that I didn't display in the previous slide, but an infographic was also very effective. In general, it had led to a 3 to 6 percentage point increase in people's intentions to get vaccinated. As you can see, the safety frame, the safety message, appears to be no more effective than the simple message. So the best performing ones here are actually no message at all. That's the control. Social norm, loss aversion, gain frame, protect the NHS, and the infographic in particular. Directionally, we see a pretty good improvement there. Also made people more like to think that their friends and family will get the coronavirus vaccine. This is sometimes a clever way of eliciting a better sense of people's intention, if they think that whether they get it, but also whether people around them will get it, and their level of concern with serious side effects as well. We saw some good results there. But although 7 in 10 people on average intend to get the vaccination, we notice lower intentions among women, Black, Asian, minority, ethnic, so ethnic minorities within the UK, and people aged under 55. And so this is another really useful thing you can get from this kind of testing is these specific subgroups that you might think, okay, we seem to have a bit of a problem with this group or this group. There's lower intentions, so maybe we need to think more carefully about our communication strategy to sort of approach, target, and capture these particular groups going forward. And so that was a piece that we did, which was all about the invitation. There's actually been some great academic work, especially this recent study by Milkman and co, where they tested many different text messages to encourage people to turn up for their vaccination appointments. I think these were the most effective. So the specific message they added that was most effective, I've put that there in blue here. So it says, you have an appointment with Dr. Smith on date and time, and it's flu season. This was a flu vaccine rather than a COVID vaccine. But still, we think pretty applicable. Because of course very similar. And so they said, you have an appointment and it's flu season, so it's the time to get it. And then a reminder closer to a flu vaccine has been reserved for your appointment with Dr. Smith. So BIT has done it previous work in terms of people attending doctor's appointments, and we do find that saying we do feel that making it clear that you have an appointment, it is reserved. Like there is a specific doctor, they've got it in their calendars there, they're waiting for you. And this particular treatment has been reserved for you, makes people more likely to turn up, makes people more likely to take up the relevant treatment, and that's what this academic work is showing also. So these additions, these messages in blue, led to a 10% relative increase in flu vaccination rates from 42 percentage points to 46 percentage points. And certainly, I think we would encourage testing in general. But specifically, we would encourage healthcare agencies and other providers to specifically look at the messages that you're sending to specific targeted individuals to invite them to appointments and to test different versions of this to identify the most effective, whether that is using online experiments of the type that I described, or this, which was a real field study, real people receiving the message. What else have we done? So in terms of our COVID-19 response more generally, of course, we're doing these little online studies in Bangladesh, as well as all over the world, of course, in the UK in particular. But in Bangladesh also, actually, we've been doing a much bigger COVID-19 project around these hand washing stations. I mentioned these earlier. We've built these, or BRAC, I should say, has diligently built 1,000 public hand washing stations, free to use for members of the public, to give them access to soap and water. And what we're doing is running a large scale randomized controlled trial where we're testing in the field. We're putting different communications interventions in different villages, by different stations, and then we're measuring usage of those stations to see which is the most effective. So we're saying, is it enough to just build the stations and do some sort of pretty standard hygiene and behavior change communication activities, things like in-person demonstrations, things like, miking broadcasts with a little megaphone. We've tried some low intensity interventions, placing up signboards and this sort of thing that just direct people towards the stations, or some high intensity interventions, having staff coming, field staff go to these stations and sort of promote them actively, encourage people to come, or encourage people on the street to come and use the stations, and also giving away free soap as a reward for people coming and using the stations, free soap and free masks. We're also working on vaccine uptake globally. As I said earlier, this is the hot topic right now. It's something we're working on, very interested in, because there's all these kinds of interesting choices that you can make as a government in terms of how you communicate this, about how you approach getting people to take up the vaccine. And so, one of the things that we've seen from many countries is these sort of very public instances of senior role models getting the vaccine. In theory, this is something about getting an authoritative messenger, an authoritative role model to sort of reassure people that, yes, I'm getting the vaccine, you should too. But I think there is this interesting question here about, what's going to be more effective for different groups. Is it more about seeing someone who's more authoritative? Or maybe is it more about seeing more like a regular person? You know, is it more about seeing, you know, someone like me, and is that more reassuring if I have a bit of hesitancy? Is it less about seeing, you know, a politician who, yes, maybe they're quite authoritative, but maybe I don't feel like they really understand my circumstances. They're not really someone like me. You know, if something goes wrong for them, they probably get quite a lot of support. Maybe it's more reassuring for me to see, you know, a frontline health worker, someone I really feel does really believe does deserve the vaccine and needs the vaccine, or maybe someone, you know, just a regular person, a little old lady here in the UK getting the vaccine. Maybe that is more reassuring for me. I'm like, oh yeah, regular people are getting this as well. Maybe that is more convincing. And these are all things that, you know, we can test, and that we would certainly encourage governments to test, so as to make sure the vaccine uptake can be as high as possible, as quickly as possible, and minimize the costs of pursuing people for that. So that's the end of my presentation. We're now going to go to questions, but thank you for those of you who were able to maintain your attention throughout. Thank you for your continued attention. And now very happy to go to Q&A. Thank you.
There you go. Thank you very much, Mr. Alexander. It's a fantastic. I find it's a fantastic presentations. I learned a lot on these presentations, and therefore we know better on how we use the behavior insights strategies or methods to increase the awareness on COVID-19, especially on the vaccinations process. We hope all of you to be able to understand better on the process and to implement and to make sure it's adapting this strategy. Again, on behalf of Malaysia Productivity Corporations, I would like to thanks again to our speaker, Mr. Alexander Clark, for his precious time and for his fantastic presentations. And therefore, we would like to again to be appreciated of your presentation. Thank you very much, Alex, and also I hope you guys stay tuned. We have a lot of segments on the during this conference. Stay tuned and be safe, be productive during this conference. Back to you, Abby. Thank you very much.